Hello everyone, I'm Ubidu Bandara from Rotaract Club of Kurunegala. I'm a graduated medical student writing for my internship. Today I'm going to talk about a disease called poliomyelitis. Poliomyelitis or polio is one of the most revered diseases during the 20th century, as it is mostly common caused to the children who is less than 5 years of age. It is an acute viral infectious disease. This poliomyelitis word is coming from Greek, as the polio means the grey color and the myelo means the spinal cord. One of the 200 infected cases end up with irreversible paralysis in polio. Out of those paralyzed children, only 5 to 10% will die due to respiratory arrest. Let's talk about poliovirus. Poliovirus is rapidly inactivated by formaldehyde, chlorine, heat, and ultraviolet light. It is an RNA type enterovirus. There are 3 serotypes of poliovirus: serotype 1, type 2, type 3. Type 1 is the most common in the world. Mainly the poliovirus spread from person to person via fecal-oral route, but it can be infected through mucus from nose and mouth also. Poliovirus only infects the humans only, and it can't last in the environment for not that long. Let's talk about the pathogenesis of the poliovirus. After the poliovirus enters the human body through the food we eat, it multiplies in the throat and it goes to the intestines and spread to the regional lymph nodes. Once they are established in the lymph nodes, they can enter the bloodstream, and through the bloodstream they will go to the nervous system, or we call the spinal cord mainly. Then in there it will multiply and it will mainly destroy the motor neurons in the spinal cord, which causes the paralysis of peripheral muscles, or permanent paralysis of the muscles in our body. Let's talk about the clinical features of a polio patient. There are 3 main categories. We are divided these polio patients according to their clinical symptoms they show. The first one is asymptomatic polio, which is the most common one. 95% of the infected polio patients are asymptomatic, where the virus stays in their intestines and doesn't show any symptoms to the outside, but still they can infect others through their fecals. So the second one is non-paralytic polio, which is symptomatic. There are like 8% of the infected people are in this group, and they will show symptoms like sore throat, nausea, vomiting, headache, and malaise. Third and the severe one is the for paralytic polio, or we call it poliomyelitis. Mainly they cause this peripheral paralysis. Most of the patients who die are due to paralysis of the respiratory muscles, or paralysis of the muscles which will help us to swallow the food. Most common symptoms which are presented by these paralytic polio patients are paresthesia, which is a pins and needle sensation in the leg, and meningitis, the inflammation of the meninges, or we call it the membrane which is around the brain and the spinal cord. And the last one is the paralysis of the legs and arms. But the most common thing is, even though the legs and arms are paralyzed, the sensation is intact. So as I told you, this polio virus infected the spinal cord. So the place where the polio virus infected in the spinal cord decides what type of organs and which organs of the bone is paralysis. If it is in the upper part of the spinal cord, it will paralyze the bones, arms and legs. If it is in the lower part of the spinal cord, it only paralyzes the legs only. Normally, this polio virus incubation period is around 10 to 21 days. Let's talk about what are the investigations we can do to diagnose a polio patient. First and the most common test we can do is the stool culture, which we will take a stool sample of the patient and check for polio virus. And we can go for we can do a lumbar puncture and take the spinal fluid and check polio virus in there also. And we can take a blood sample and test for the antibody level in the blood. Let's talk about the treatment and management of a polio patient. As there is no cure for polio, we are mainly going with a symptomatic treatment for a polio patient. If there is an infection, we will go with antibiotics. If there is any pain, we will go with any analgesics. Normally, we will give physical therapy, braces, or corrective shoes to support the day-to-day activities of the patient. We will do portable ventilators for breathing problems like iron lung, as you can see in the picture. We will ask the patient to do the moderate exercises to develop the muscles in the legs and the arms, and we will give a good nutritional diet, as most of these patients are children. How do we prevent polio? In Sri Lanka, we have a wonderful and well organized immunization program to prevent polio. It is done by EPI schedule, or Extended Program of Immunization Schedule in Sri Lanka. There are two types of vaccines we are using in Sri Lanka. First one is oral polio vaccine, or another one is IPV, or inactivated polio vaccine. Oral polio vaccine, or OPV, is most commonly 99% of the time we use OPV. So we will give OPV to the 2 months, 4 months, 6 months, 8 months and 5 years of age children. And we also have a successful surveillance program from 1991 to detect any of the polio patients in around the country. Since 1993, we didn't have a single patient of polio. In 2014 March, WHO has announced that Sri Lanka has eradicated polio. Let's talk about the global polio eradication. Most of the countries in the world have eradicated polio, but still countries like Pakistan, Afghanistan has polio patients up to today. Because of this, WHO has announced that October 24th as the World Polio Day. Thank you everyone for listening. I hope you guys get a good knowledge about the polio virus, and